everyone, Dr. Shervin here with another episode of Dental Tips of the Week about dental bridges, and I'm very pumped to present this to you because this is a very common treatment modality, and many people are not aware of the risks, complications, and benefits of this treatment. So let's dive in. First of all, I need to let you know what a dental bridge is. When a tooth is lost, as you can see here, a dental bridge actually is consisted of two crowns on the neighboring teeth and a crown in the center, which is connected to the neighboring ones in a form of a bridge. Then this structure is glued on the top of the neighboring teeth. So as you can see, with this approach, we don't have to do any kind of surgical step, as I told you last week about implants. So that could be an advantage. But on the other hand, as you can see here, we need to touch the neighboring teeth. And it could be a disadvantage, especially when the neighboring teeth are quite sound. So every case should be evaluated individually. And in some cases where the neighboring teeth are affected by previous fillings, or even they had undergone like root canal treatments or some things like that, and they need some form of reinforcement anyway, doing a bridge could be one stone to kill two birds. How? Because we could simultaneously put crowns on the neighboring teeth, strengthening them, and then a crown in the center to replace the missing tooth. But still, with all advancements in implant treatment today, still doing two single crowns on either side and an implant in the center is the preferred option. All right, so I was meant to talk to you about 3 wrong beliefs about dental bridges. The first one, many people come to us and ask, well, I want a bridge to replace this missing tooth. I said, okay, we need to prepare the neighboring teeth. And I say, why? I know that there are some forms of bridges that you don't have to prepare at all. It's not true. Why? Because those crowns on the neighboring teeth have a certain thickness. We obviously don't want to provide patient with a bulbous, large crowns. The size of the crowns should be exactly the same as the previous teeth. So how could we do this? We need to reduce from the neighboring teeth the exact amount of thickness of the crowns so we can provide patient with a beautifully made, right size replacement. So this belief is completely wrong. It's not possible to not touch the neighboring teeth and have a bridge inside. The second wrong belief is that some people may think, okay, it's a straightforward procedure. I go to the dentist, they prepare my teeth, and they make me a nice bridge, and that's it, and I'm out. That's it. It's wrong. Why? First of all, if the teeth around are normal teeth with nerves inside, the root canal treatment hasn't been done previously, whenever we do a bridge preparation, we need to do the preparation all around. We need to shave off from the neighboring teeth and then take an impression. This is an irritation to the nerve inside, and in some cases the chances are slim, not too high, but it is quite possible that the nerve inside the tooth cannot tolerate all these irritations and it begins to play up. if such a thing happens, it's not the end of the world. The neighboring teeth could have root canal treatment done, which I will talk about in a different video, and then a bridge could be made on the top and everything will be fine. But this belief that, okay, it's a straightforward procedure, nothing specific needs to be done, and it's just like a preparation, impression, and insertion, no, it's wrong. The third belief, which is the most important, I think, is that people normally think that when they have a crown or a bridge, they think that all the surfaces of the teeth are prepared and covered by the crown and bridge, which is right. This is why they may think, okay, if all the surfaces are covered, I don't have to keep them clean. But it's exactly the opposite. Whenever a bridge is made, because there is a margin for the bridge, that margin is always vulnerable to bacterial attack and dental decay. So for a bridge, this issue is a little bit more complicated because these three teeth are connected and I cannot pass the floss between them. But there is another way to clean up underneath the bridge, like here. And I'll show you. So a bridge definitely needs maintenance, it definitely needs hygiene, and it should be done on a daily basis. I don't say it's a cumbersome thing, no. You just need to spend possibly 2 minutes to clean up your bridge every day. So it's nothing like a big issue. So the procedure, let's go through this. As you can see here, the tooth is lost. The neighboring teeth are getting prepared. The bridge is fitted and inserted and glued. And it's something like, it should look like normal natural tooth. Very comfortable, without any need to remove or like something removal of it, clean it and pop it back. No way. It's just like a normal natural tooth, but it needs hygiene, definitely. So, in terms of hygiene, there are many ways to clean it up. Using interdental brushes, using different kinds of floss underneath, could easily help us clean up those bacteria that could lurk underneath the bridge. And if not done properly, that's the consequence. The neighboring teeth could decay, and in many cases, by the time dentist notices this decays, it's almost too late, and the tooth is lost. So, please don't get me wrong. All I said was about the risks and possible complications, and there are many benefits as well. So, in dentistry today, as I told you, the implant is the first option, that's for sure. But in many cases, bridges, if properly made, could last for a long time and provide you with ultimate function and aesthetics. Thank you very much for your attention. Next week, I will talk about the third option to tackle tooth loss, which will be the denture. Please stay with us, like us, and put your comments down below. Thank you and enjoy the rest of your night. Bye.